Hello, my name is Angelica Gideon. I want to thank you ahead of time for taking this time to hear my cause in mental health illnesses. The thesis of the speech is to increase the awareness of mental health care and the efforts to provide and increase resources to the public. Awareness of yourself and others. I want you to take a moment and imagine you or your loved one was suffering from a debilitating mental health illness. The medication needed to fully recover and be functional in society was denied, and instead giving a less therapeutic medication with low probability of effective treatment. As a healthcare provider in a hospital, I have witnessed multiple times where a patient presented to my unit either suicidal or in manic state. Causes of uncontrolled behavior are due to unawareness of early symptoms of depression or current medication regimens were not working. This is the reality we face. I will be discussing two major points, lack of resources in mental health illnesses, and how can we increase awareness of mental health illnesses. Challenges with the lack of resources when seeking treatment in mental health. New government policy take efforts to decrease the cost of mental health treatments. Prior authorization treatment is one of its first policies. Prior authorization treatment hinders care for those suffering from mental health illnesses. Prior authorization treatment obstructs care for those suffering. Prior authorization policy effects. The stipulation has left a deficit in the individualized care of the disorder. Prior authorization has limited or cut down the amount of drugs prescribed. Alternative non-therapeutic medications and time-lapse and changing medications have shown an increase in mental health illness relapse or non-adherence to treatments. A study conducted in 2010 by a community mental health centers and a group of physicians in Maine showed that prior authorization policy has helped reduce the cost of medication. However, there were increased ER visits and increase in relapse. This raised concerns for quality of care for the mentally disorders. Step therapy regulation was another enforced policy. This policy intent is to use alternative medications that cost less, even if this meant not the right medication for an individual. With the use of antidepressants, a study was conducted in 2010 and published in PubMed. It showed a decrease in cost of medication supplied after step therapy. However, there was an increase in inpatient admissions and emergency room utilization. Lack of trained personnel to recognize early signs of mental health disorders. Concerns rise in the amount of behavioral and mental health disorders diagnosed by pediatricians who have limited resources and appropriate training. A random survey in 2005 showed primary care pediatricians and child adolescent psychiatrists agreed it's the pediatrician's responsibility to identify the symptoms and refer children to mental health problems to psychiatrists for proper treatment and follow-up. Mental health services are not easy to find. These are other challenges we face in our society today. A few statistics. 2008 National Institute Mental Health showed that adults disorders include 14.8% major depressive disorders, bipolar disorders 5.7%, 2.4% schizophrenia, panic disorders 6%, generalized anxiety disorders were 6.8%, 15% were social phobia, and 4.5% were Alzheimer's. A 2010 Journal of American Academy of Child Adolescent Psychiatry showed 49.5% of the U.S. adolescent met criteria for mental health disorders, ranging from mood disorders at 14%, 31.9% were anxiety disorders, 19.6% were behavioral disorders, and 11.4% were substance use disorders. How can you help? Increase awareness of mental health illness. It can save a life. Recognizing the signs of depression and getting early treatment can save a life. National Alliance on Mental Health educates and supports and offers resources for the public and for those suffering a mental health disorder. Educating yourself can help you communicate with those who may be suffering from a disorder or yourself. I want to thank you again for this opportunity. We talked about the lack of resources in the mental health illnesses due to policies and lack of training. Secondly, we discussed the importance of increasing awareness of mental health and mental health illnesses potentially saving lives. Thank you again for this opportunity. Have a good evening.